So the sexual assault nurse examiners are nurses who have advanced specialized training in doing trauma-informed exams for victims of sexual assault.
Where our goal is for the nurses to actually develop a skill set for taking care of patients who have experienced sexual assault, and to also build confidence in performing these exams.
I'm interested in sexual assault forensic examiner training in general because I think it's a need in this community, and this type of training allows us to have professionals that are trained to provide compassionate care and also collect evidence that can be used against potential perpetrators and alleged perpetrators in the future.
Historically, presenting to an emergency department for sexual assault survivors has been a form of secondary trauma. These folks show up to the ER, they wait for hours for an exam. That exam is sometimes done by a person who has never done an exam before, who might not collect the evidence kit in a way that preserves the evidence effectively, or who might conduct their exam and interview in a way that can be traumatizing.
This medical cohort has a passion for what we are doing. It is really hard to work with someone in some of their darkest moments, especially when you're working with acute sexual assault or domestic violence or trafficking. What I will say is the 10 plus actually have 11 medical staff. They're not all nurses. We have a physician, we have 2 PAs, a nurse practitioner. We're really excited that so many of them, it's their passion along with mine, which is really making it move forward and get this ball rolling and going. I hope that there will be more that come into the fold, and I hope that we'll be able to inspire other agencies, other communities to have their own.
Safelight really has it all. They house the Family Justice Center and the Child Advocacy Center. So they're the perfect place to be able to bring victims and survivors, and perform these very intimate and vulnerable exams, and then be able to warmly hand off those victims to services that can help them kind of get their life back on track and seek legal ramifications if they choose to do so.
At Blue Ridge Health, we know we help people the most when we empower our team to follow our passion for compassionate healthcare. And we jumped at the opportunity to partner with a great community organization like Safelight to improve health and inspire hope.
When you talk to other people in the state who do this work, what Safelight is trying to build here is their dream.